Our final segment today will focus on mental health and positive well-being. On stage will be Dr. Zainab Hijazi, UNICEF Senior Mental Health Technical Advisor. Zainab will be speaking with interactor Sara Pimprikar, 16 years old and in the 11th grade class. From there, Zainab will speak with Gary Shaughnessy, chair of the Zurich Foundation Board. Following that discussion, we will hear from our final Rotary Person Action, champion of girls empowerment, Motalib Wehters from the Uden Rotary Club in Bangladesh.
Hello, everybody, and welcome to this important thematic session aptly titled Breaking Down Stigmas Related to Mental Health Issues. My name is Zainab Hijazi. I'm the Senior Mental Health Technical Advisor with UNICEF based here in New York. Now, mental health is a global issue, and this is reflected in the need. UNICEF's State of the World's Children report on mental health and well-being reaffirmed the mental health statistics around the world that are quite staggering, affecting so many children, adolescents, and caregivers, affecting the quality of life with enormous impact tied to the global burden of disease, ultimately affecting the survival of people, particularly young children, who are living and struggling with mental health issues. But before we jump into the discussions with our wonderful panelists today, please join us in viewing this important short video to help bring to consciousness the scope of the problem impacting our children's mental health and psychosocial well-being. As you can see, the challenges are huge across rich and poor countries. And until now, mental health has had many global advocates. But a lack of global urgency and the need for more robust funding has really limited the potential for sustained implementation and scale up of program and services. Growing awareness around the mental health of children, its importance, particularly in humanitarian settings, and the impact of COVID-19, which has really brought about a lot of conversation around mental health. And this is a conversation that we at UNICEF have welcomed entirely. All of this has really combined to create a momentum around mental health and well-being concerns of children. And that's our role today, and that's why we're here, is to keep that momentum alive. But the stark reality really is that, worldwide, the majority of those who need mental health care do not have access to quality services. And stigma is seen at the root of those challenges. And so we must really address those intersecting stigmas. But human rights, gender equality, and protecting the mental health needs of the most vulnerable persons and groups is really at the central to a successful approach. This means acknowledging that girls are more likely to experience violence, lower education, poverty, and psychological distress. And this results and puts girls at risk and the likelihood of internalizing conditions such as depression and anxiety. Mental health conditions in male adolescents put them at higher risk of suicide, conduct disorder, substance use, and interpersonal violence. And when compared to older women and older mothers, adolescent mothers are at increased risk of mental health conditions, especially postpartum. We have a really great panel today to help us really unpack some of these challenges that we're seeing in global mental health, but also give light to some of the solutions that we've been able to see around the world and where we see youth at the forefront of. First, we'll have the pleasure of hearing from Sara Pimprikar about what's on her mind. Sara is a teenage girl active in her community as an interactor and supporter of the Rotary Action Group for Mental Health initiatives. Hi, Sara. Thank you for joining us virtually from India and to share your perspective on mental health with us. So, Sara, can you share, tell us a little bit about yourself and the Rotary Action for Mental Health initiatives and how you became involved?
Yeah, my name is Sara Pimprikar and I'm a grade 11th student in Wisdoma International School, which is in India. I am a member of the Interact Club, and Interact Club is a club that acts as Rotary, but for students in school. So I was working for Rotary, and my mother is actively involved in RAGMHI and DAGMHI. So that is how I got involved in the project, and I started working on mental health initiatives.
Thank you, Sara. You know, it's really always inspiring to hear these examples firsthand of how, you know, youth are at the forefront of these issues. So it seems, you know, through this initiative that you're doing so much for others. Can you tell us a little bit about how you take care of your own mental health?
Yeah. So according to me, whenever you feel like things are just piling up or you yourself are feeling burdened, sad, or just low, I think the best thing that you can do is take up on your hobbies or do something that makes you happy. I am a Kathak dancer, so whenever I feel low, what I do is I just dance my heart out, and that helps me a lot. So according to me, every person must find their go-to activity or their stress buster, which helps them calm down.
Thank you so much, Sara. I think those are really important examples of self-care, and I think they're examples that really transcend age and generations. I think we all love to dance, so I think that's really wonderful. Thank you for sharing. Before I let you go, Sara, I have one more question for you. If you could share one thing with the audience, one key takeaway, what would it be?
Yeah, so mental health and mental well-being are both stigmatized topics, and according to me, it is our responsibility as a community to break these stigmas and rise above them. So the first step to that is opening up and speaking about mental health, about your own mental health. You should try and learn more about mental health through internet, through books. There are many resources available. So access them, make the entire use of them, and just follow up on people that are around you. Talk to your family, talk to your friends, and start speaking up about mental health. And the best way you can be a part of this initiative and help us break this stigma is you can join RAGMHI, you can join DAGMHI, or you can create your own district chapters. And I would really like to request all of you to be a part of this mental health initiative and help us all make this world a better place.
Thank you so much, Sara. Well said, and thank you again. Yes, thank you for being such a powerful voice and an advocate for mental health. I'm really humbled to have gotten to know you and to share this platform with you. We wish you the best of luck in your work. So we now shift to the second segment of the session, really bringing to light the importance of partnerships in the space of mental health and how leveraging our collective strengths is really the most effective route for achieving the best impact for children. Z Zurich Foundation and UNICEF have partnered to advance the global mental health agenda and address really the challenges that our young children are and adolescents and caregivers are facing today. Together, we are launching a new global coalition for youth mental health. And joining us today on behalf of Z Zurich Foundation is Gary Shaughnessy, Chair of the ZZF Board of Directors. Welcome, Gary, and over to you for a quick introduction.
Thank you very much. Just listening to Sara, I mean, really powerful, and I think makes a lot of the points that I would like to make, but much better, which is this combination of the need for understanding at a local and real, practical and personal level of the impact of mental health conditions and the stigma particularly that continues to be there around mental health, and at the other side of things, which is the global solutions that do exist but aren't yet understood and delivered in a way that is relevant to people in local constituencies and markets. And the foundation has partnered with UNICEF because of the ability to bring those solutions from a global basis to individuals across the world in a way that works for them.
Thank you so much, Gary. And you know, we heard from Sara, and we know about the work that you're leading. And you know, youth are really at the forefront of local innovation and local solutions to support their own mental health within their communities. But really, at the heart of the partnership with Z Zurich Foundation is to really include young people as change agents and as experts by experience. We know young people have an important role to play in changing the conversation and changing the dialogue so that we're better able to talk about mental health in our personal lives, at work, in all of that we do to protect those most vulnerable, and to really start to help tackle some of those intersecting stigmas that impede the availability and accessibility to mental health services. So can you tell us a little bit about, you know, some of those accelerators and some of those issues related to youth mental health, and you know how funding plays a role, how you know community-based care and prevention and promotion particularly are part of that more comprehensive approach to mental health care?
Yeah, and role models locally play a crucial role here, but it's really important that they don't play that role on their own, and that we don't leave them alone to stand on their own to do so. We've already seen that action taken around prevention and early action and preemption has a dramatic impact on mental health conditions. And stigma is a poison, if you like, that's really currently getting in the way of open action and open discussions, and a situation where people can genuinely share their feelings and their emotional needs and get help and support when they need it and early when they need it. One of the statistics on the introduction that you gave was the fact that less than 2% of health budgets across the globe are devoted to mental health, but almost a fraction of those budgets are devoted to preemptive or preventative mental health. So for me, the first thing we've seen is dramatic impacts of role models, but as a society, what we're looking to do is to stand shoulder to shoulder with the youth of the world, to make sure that we bring together capabilities from government, from the private sector, from the public sector, to support those role models, to support those individuals, so that we stand right alongside them in really moving from awareness to understanding, to getting rid of the stigma and moving to a position where all young people are able to speak out about their feelings and their emotional needs. And that needs funding, absolutely, but it needs people with different capabilities. The solutions and the tools are generally actually very available. They're just not able to be deployed in a way that's relevant to different markets, and that's the purpose for working with UNICEF and other partners, and in a way that is cracks through this real barrier of stigma, which really does need us to work alongside the youth of the world.
Thank you so much, Gary. You know, we talk a lot about, you know, the importance of taking on a comprehensive approach. And I think it's important for the audience to really understand as well that, you know, when we talk about mental health, we're talking about a continuum. You know, mental health is not just the absence of a mental health issue. You know, we are all on this continuum of well-being, and we slide on it from, you know, left to right, depending on where we are in our lives. And I think an important message really is that, you know, mental health issues or mental disorders are not inevitable, and they are preventable. And I think this is what really is at the heart of this partnership with, you know, ZZF, that really focuses on the prevention and promotion aspect, really looking at early childhood and adolescence as key windows of opportunity to support them to address mental health issues, and to really think about those entry points for care, whether it's within the home or within schools or within communities, and really moving away from this medicalized approach that focuses solely on treatment. And you know, Gary, you mentioned funding, you mentioned the Youth Coalition for Mental Health. It would be great to learn a little bit from you about, you know, when is this coalition going to launch? And what is, you know, its significance as well in relation to some of the humanitarian emergencies that we're seeing, whether it's, you know, Yemen, Afghanistan, Myanmar, or more recently in Ukraine?
Yeah, the launch date will be the 7th of April, and the catalyst for the 7th of April is the appalling situation we're seeing with refugees fleeing from Ukraine at the moment. And as you say, that's mirrored in refugees in different situations across the world. We, as Z Zurich Foundation, are putting in place partnerships for psychological support for individuals fleeing through the Eastern European countries that border Ukraine, but we're also working with UNICEF to broaden that to areas where refugees are displaced on a wider basis. And the fundamental impact that and the scars that will come from the current situation for many families and certainly very many young people. And I think with that in mind, we're really looking for people to partner with us as we launch, but on an ongoing basis, to stand together with us as soon as possible and help use the catalyst of the refugee situation to save the futures of many, many people, but also to then use that as a real starting point to make sure that we do that on a wider basis in situations that aren't as dramatic, but are certainly painful across the world.
Thank you so much, Gary. Really a strong and compelling call to action. A warm thanks to you and to Sara for joining us today and distilling your knowledge and expertise upon us. You know, just building off the last call to action that you made, the global community really now has a historic opportunity to strongly position the global child and adolescent mental health agenda across all of our work and all settings, and as an integral element to the achievement of the Sustainable Development Goals for leveraging commitments and resources and integrating mental health into all of our sectors. Each of us has a role to play. Child and adolescent mental health has taken central stage as a corporate priority for UNICEF, and we all call on partners to champion this agenda, to join the Coalition for Youth Mental Health and take part in our global campaign, which if you haven't heard about, it's called On My Mind, #OnMyMind. And so it is really through our concerted efforts that we can begin to really see change and improve the mental state and well-being of our children around the world. Thank you everybody so much. With this, we draw the session to a close. I really thank you for your generous time and attention.